The current crisis that the ambulance industry is facing in this government shutdown is a little bit unprecedented.
As the shutdown of the federal government nears a 3-week mark, first responders are now sounding their own alarms, warning that the longer it goes on, the more you may feel it. Thanks for joining us for TH11 News at 5. I'm Rolly Hoyts.
And I'm Faith Woodard. EMS officials say halted payments have left ambulance services in a huge bind. Tonight, THV11's Maya Ellison breaks down what this means for communities across the state.
Day 20 of the government shutdown, and for Arkansas's first responders, it's not Washington they're watching. It's how the shutdown could impact how quickly help arrives when someone calls 911.
The current crisis that the ambulance industry is facing in this government shutdown is a little bit unprecedented.
Ken Kelly with the Arkansas Ambulance Association says most ambulance services in Arkansas depend on Medicare, between 50 and 60% of their revenue. But the Centers for Medicare and Medicaid Services, or CMS, stopped processing claims during the shutdown.
Basically, providers are now receiving reduced payments. We're actually receiving no payments currently. The units may not be able to be staffed because the service can't afford to do critical maintenance to keep them roadworthy to respond in their communities.
For rural communities, it's an even heavier hit. Add on Medicare payments, which help smaller towns offset lower call volumes, expired September 30th. That means longer response times, fewer available ambulances, and more strain on fire and police.
It's going to be a tremendous administrative burden. So our first responders would have to be on the scene longer, waiting on the transport ambulance to arrive. And then there are certain added costs to them. This also will impact our hospitals. It could cause longer transfer times in getting patients to the definitive care of a specialist that they might need.
Kelly says many ambulance services are pulling from cash reserves just to stay open. But if the shutdown continues, the impact could go beyond inconvenience.
And like any other business, if they don't have the cash to operate, they close their doors. That leaves that community with a gap. So I would just encourage every citizen to be engaged with what's going on in your ambulance service. Talk to your ambulance provider, talk to your health leaders in your community, and let them know that EMS is an essential, vital service, needs to be properly funded because we are there for the community.
In Valonia, Maya Ellison, THV11 News.
Maya, thank you. CMS initially put a hold on all Medicare ambulance claims, but quickly walked that back late last week. Now, Kelly says that does slow down the crisis for local operators a bit, but it'll start to pinch the cash flow if this shutdown drags on. As for activity in Washington here on day 20 of the shutdown, the Senate reconvened to hold yet another vote, hoping to break the stalemate up there. Republicans and Democrats continue at odds as Democrats have pushed for negotiations over health care tax credits to be included in a funding measure.
We should be able to wrap this up this week if they will sit down and have a negotiation with us. The president has spent 1 hour negotiating this issue with leadership in Congress. That's it, 1 hour. They need to get in the room and stay in the room until we can hash this out.
20 days since the Democrats recklessly shut down the United States government. And the Democrats are making some very costly history here. Don't lose that in all that's happening. This is now the third longest shutdown in history.
And House Speaker Mike Johnson also said today he'd bring the House back into session if the Senate passed a bill to pay federal employees and military service members who have continued to work during the shutdown. Senate Democrats blocked a bill that would have paid the military last Friday.